All right. Thank you guys so much for joining us tonight as we talk about fertility and your 4 phases. I am really excited to be here with some colleagues of mine. We have Michelle Siazon, who is a registered nurse, a fertility acupuncturist, and she worked in the labor and delivery unit for years, assisting births, caring for mothers postpartum, and teaching breastfeeding. I also have Suzie Husami, who is a California board certified acupuncturist and herbalist specializing in reproductive health with over 5 years of clinical experience. She practices in San Diego at Husami Integrative Acupuncture. So if you're in San Diego or the area, go check her out. And that was founded in 2013. And then I also have Kristin González, who is a licensed acupuncturist, board certified herbalist, and guide into the lost art of radical self-care called Nourishing Life, or Yang Sheng. Chris, if you remember, helped us out with a past webinar called, I can't remember what it was called.
What is a healthy cycle?
What is a healthy cycle? So this is kind of the follow-up to that webinar. And if you missed that webinar, or if you want to go back and watch it again, I definitely encourage you to do that. But for women who are either looking to get pregnant or looking to not get pregnant naturally, I think this is going to be a really helpful webinar. So I'm really excited to share it with you. So just a couple of quick housekeeping things. We love having you guys participate in these, so we just really would love to hear your questions, hear your experiences. So feel free to use the Q&A feature of the Zoom, or you can comment on the Facebook Live. We'd love to hear that as well. And then I also just want to point out that these are all suggestions. We obviously have 3 women who are super seasoned and know a lot about fertility. But if you have any questions, these are just recommendations. Like, we can't tell you exactly what you need without looking at you. So if you have extra questions or you want to be seen, definitely consult your primary care physician or your own acupuncturist. So with that, we'll get started. So you can go ahead, Chris.
Hi, everybody. So I see there's about 6 participants right now. So definitely use the chat feature to ask questions. Tracy's gonna be keeping track of all those so that we can answer your questions at the Q&A section. Definitely say where you're from and what you're interested in the most on this particular talk. And like Tracy said, we gave a previous talk on what a healthy cycle looks like. So it gave like a really kind of overview on the kind of criteria to look for like a healthy menstrual cycle. Okay, so we can get started. You guys ready? Thumbs up? Okay. So fertility and your 4 phases. So like Tracy said, there's a disclaimer here. And these are the panelists here, Suzie, Michelle, and myself. All right, so let's actually talk about what fertility is and what we're actually talking about. So there's a little bit of a different concept regarding fertility. Us being acupuncturists and part of like Eastern medicine, we have a different view on what fertility actually is. So let's actually go over the Western concept first. So, and these, of course, it's not like complete, but this is kind of what we came up with. So the quality of being fertile, productiveness, to improve the soil fertility by adding compost. So you can talk about fertility and kind of like, growing plants and so forth. And also natural ability and capacity to conceive children or young. So the Western concept, I feel like, and you guys can chime in if you want, really focuses on the ability or capacity to actually conceive and have children. Whereas the Eastern concept, let's go over that really quick. So the Eastern concept actually looks at fertility as optimum health for both men and women. So meaning that you work on your overall health and you live in a way that follows your natural rhythms, and you live in a way that just harnesses your whole health in general, and that feeds into fertility. If you have optimum health, then you have fertility. It kind of goes together. So it says here, fertility as a result of whole body health. And the overall goal is to conserve, preserve, and cultivate one's vitality so that you actually embody fertility. And so that goes into the Western concept of your natural ability to actually conceive and have children. Did you guys want to chime in on anything on that? No? Okay. Yeah?
No, you're good. Yeah, I think you're good. I think in case anyone's wondering what that TTC means, a lot of people know what it is, but some might not. It means trying to conceive. So even if you're not trying to conceive, you can still have awesome reproductive health, and that's our goal.
So there's an airplane flying over, so I'll just wait a minute. So like Suzie said, so like Suzie was saying is TTC meaning trying to conceive, but just because you maybe have the goal of trying to conceive doesn't mean that the whole subset of women or men that are not trying to conceive would not still work on their fertility. Fertility is optimum health in Eastern concept. So if you work on optimum health, you are actually working on fertility and vice versa. All right, moving on. So we're going to talk about the feminine cycle, the menstrual cycle. And it's actually for women, it's a really, it's a vital sign really. And so it's a really great way to actually hone in on how your overall health is doing by kind of sinking into your menstrual cycle. So let's go ahead and learn how to embody fertility by learning about our 4 phases. All right. So I just have a quote here just for fun. So if we recognize that our biological rhythms are the rhythms of nature, then we readily understand the need for balance of rest and activity within our monthly menstrual cycle. And so as we kind of go through the 4 phases, of rest and activity according to where our phases are very distinct and different from one another. And I feel like in the society we live in such a linear kind of way, and women actually just don't function that way. We're very dynamic, and in one menstrual month we go up and down, side to side, yin and yang, all throughout the menstrual month. And I feel like if you learn this, then you can actually hone in on what you actually need at certain times of the month. Does anybody have any questions that are like tied to that in particular, Tracy? Not yet? Okay. All right. So these are the 4 phases, and of course the dates are going to differ from one woman to another. So just take them lightly. These are kind of generalities. So phase 1 is basically your period time, your menstruation. And in Chinese medicine, we coin it as the blood phase. And then it moves into phase 2, which is called the follicular phase. And this is what we coin as the yin phase. And the days roughly are around 6 to 12. So the days across, if you don't know, so these are the days 1 through 28. That's the length of a kind of a healthy cycle, anywhere between 27 to 32 days. And so that's why the days can kind of vary from woman to woman. So day 1 is the day that you start your period. Day 28 is the day that you end your period or end your cycle and then start your next period. And so phase 3, this is ovulation, and this is where ultimate yin. So you have your first 2 phases where you're shedding your lining, and then you're building your yin, you're building your endometrium, and we're going to go into detail about this later. So you have ultimate yin and it converts to yang. And then you have phase 4, which is your kind of your premenstrual phase, also known as the luteal phase. And this is coined in Chinese medicine as the qi and yang phase. Am I going too fast? It's okay? Okay, so this is just another way to look at the phases. So on the upper right-hand corner, you have your blood phase and the approximate days, days 1 through 5. And under the phase, that's kind of for practitioners, what the overall goal of that particular phase is. So for phase 1, move qi and blood, and then moving around to phase 2, we really want to nourish blood and yin because we just lost blood. And then moving to phase 3, which is ovulation. And we want to strengthen the yang because that transition from ultimate yin to yang is kind of a hard process. And so you need to support that in order to ovulate correctly. And then moving around to phase 4, this is your premenstrual phase, and the goal is to boost yang and qi during that time, to warm. All right, so we're actually going to go into each phase in more detail. And so I'm going to pass it over to Michelle Siazon, and she's going to go over phase 1 and phase 2, which is our blood phase, menstruation, and then also the yin phase, which is the follicular.
Hi, everyone. I love that Chris asked if she was going too fast because I'm a much faster talker than her. So please feel free to slow me down if I'm moving too fast. So the follicular phase, which I'm going to talk about, actually has 2 parts. There's phase 1, which is your menstruation when you're bleeding. And then there's phase 2, which is pre-ovulation. So let's start with phase 1, menstruation. So again, this is days 1 through 5 of your cycle. Everyone's different, so it might not necessarily be those days for you. And the goal here is to shed, right? We really want to make sure that we're getting rid of last cycle's lining, that old blood, and we're starting fresh so that we're laying down a nice, smooth foundation for your lining to build. It's really about spring cleaning, right? You're clearing out the old to start fresh. During this phase, basically, progesterone and estrogen are the 2 main, I'm a little bit nervous, sorry, are the 2 main hormones for reproduction. And so your progesterone levels drop and your period starts. And so both estrogen and progesterone are low during this phase when you're bleeding. And so your energy is typically low too. And so things that you can do during this phase are to rest, right? It's really important to rest. So taking care of yourself and conserving energy, going inward, being more quiet, doing things like meditation. I feel like as a culture, you know, when women are on their period, myself included up until a few years ago, we tend to just push through things, right? We push ourselves, and the most ideal thing to do is to do the minimal amount of things possible. So work if you have to work, go take the kids to school, do all of those things that you absolutely need to do, but don't do anything extra. Don't go to work and then go out with your friends and stay up late and drink, right? You wanna minimize all of your activities, take naps. That's really important, and just conserve energy. And another thing that you want to do, you know, you're supposed to be getting like 7 to 8 hours of sleep in general, and they say on your period you should tag on an extra hour, right? So if you should be getting like 8 to 9 hours of sleep actually. During this phase, it's also really important to keep warm. So the most important parts of your body to keep warm are from your abdomen down to your feet. There's a lot of reproductive channels in Chinese medicine that are, you know, start at the bottom of your feet and go straight into your uterus. And so you want to make sure that you're wearing socks and closed-toed shoes. Heat packs are great. You can use heat packs on your stomach. They're great for cramps too, on your low back, on your feet. And then along with temperature, same thing with food and drinks. You want to make sure that you're having nice warm food, nothing raw or cold like salads, ice cream, juices, things like that, ice in your drinks. You want to make sure everything's warm, because a lot, again, those channels are more open, and so they're more susceptible to taking on cold. And cold in Chinese medicine is one of the main factors in infertility, right? If you think of cold, like think of a river. A river should be flowing beautifully, right? And in the winter, when it freezes over and it's cold, it starts to slow down, which is not what you want for fertility. You want everything flowing beautifully. And so let's see. So warm temperature, warm foods, warm drinks. And then the other thing is gentle or restorative exercise. So if you really feel like you want to get out there and do things, some gentle things that you can do are qigong or restorative yoga. Things where, or a walk out in nature is great, just nothing where you're actually sweating. Again, when you're bleeding, you want all of the focus of your body to be on shedding that lining so that you're having a nice foundation for your next lining. Let's see. And the next slide.
Can I chime in really quick?
Yes, please.
Yeah. Okay. So this is like, I feel like the area where women have the hugest opportunity to make a shift in their menstrual health or their reproductive health is during the menstrual phase, the period blood phase, because I feel like it's such a shift in mindset to think that you can actually rest during your period.
Right.
Like, you know, we're just kind of in a culture that really really honors kind of productiveness and go, that kind of energy, right? Get 100 stuff done on your list. Even if you're on your period, just push on through. And so in Chinese medicine, what they realized is because they observed nature and women were part of nature, they observed that you have this huge drop in hormones, and huge drop in hormones means less energy. And so if you follow that rhythm, you actually help to restore yourself quicker and more efficiently. Because if you're already down and you're just pushing on through and caffeinating and getting lack of sleep and doing the 100 things on your to-do list, then you're actually burning through all your good stuff, basically.
Right, and taxing your adrenals.
Yeah. So I feel like it's a real paradigm shift for probably a lot of listeners right now. Like, you know, you naturally have this downward energy during your period, and so it's hard for us to actually embrace that and to follow our rhythms of like taking extra naps, eating warmer foods, really nourishing ourselves during that time.
Right.
So
that goes back to the red tent, right? It's been around for years, hundreds and hundreds of years, where women would get together when they were on their cycle and basically do nothing. They would eat chocolate and dessert and hang out. And wouldn't it be great if we could do that today?
Sure.
Yeah, let's all sit around on some hay when we have our period. I would love that. Yes. Well, and that is, I think, Chris and Michelle, you guys bring up a really good point about that. Our society doesn't always make it easy. So we're expected to be at work at a certain time. We're expected to do all these things around the house. But I think, to Chris's point, if we can nourish ourselves, maybe we can take a little time out on the weekend if we know we're about to get our period. Do some meal prep, you know, plan ahead for it so that maybe when it comes, you can take a little bit of time out. Yes, absolutely. To really honor this period and go inward is really, really important. Okay, so clotting and pain and cramping, that is not uncommon, but that is not totally indicative of a really healthy menstrual cycle, right? So I talked about before, we really want to just take it slow so that we honor that reproductive energy and what our body is trying to do, so that it is able to do that, to clear out that stagnation. And to normalize your menstrual cycle and to keep you pain-free by balancing your hormones. And so then the next slide.
disease. Okay, so phase 2 is pre-ovulation. And this is typically from days 6 through 12. Again, every woman is different. And the goal here is to build. And so during this phase, progesterone is still pretty low in relation to estrogen. Estrogen is dominant during this phase. Energy is pretty high. Usually this is when women are feeling pretty good. They're in a good mood. They've got nice energy. And your lining is building during this phase. Your follicles are growing and your cervical mucus is increasing. So it's called the follicular phase because your ovaries are growing follicles, and these follicles will get large enough to trigger ovulation. And it's also called the proliferative phase because your uterine lining is growing from almost nothing to a nice thick padding, and that's what we really want, right? For fertility is you want a nice thick uterine lining for the embryo to be able to implant. And then the next slide.
Can I jump in real quick?
Sure.
I don't know. I just wanted to throw this out there also. I know it might seem like a really basic idea, but in case you don't know what a follicle is, that's basically like where the egg lives in our ovary. So during this phase, when she's saying the follicle is growing, that's where our eggs are housed. So you guys might all already know that, but maybe someone doesn't. So I just wanted to throw that out there.
Very good point.
It's our egg house.
Yes, and yes, the egg house. And also think of this, ladies. It's really important, which we're not really discussing it in this particular talk, but your eggs are sitting in this follicle, and there's this fluid in the follicle that is nourishing those eggs. And so you really want to make sure that you are taking care of yourself, exercising and eating healthy, because you're nourishing those eggs, right? The quality of that fluid is what is affecting the quality of your fertility.
Can I chime in really quick?
Yes.
Okay, so I just wanted to talk about estrogen really quick, because I feel like I like to talk about all the controversial things. Okay, so with estrogen, it gets a really bad rap. You hear estrogen dominance, estrogen in your environment, you get so much estrogen. So you need estrogen. You need estrogen to have a very healthy, harmonious cycle.
It makes us women, right?
Yes.
It gives us our breasts and our booties.
Booty. Yes.
Our curves, right? We want estrogen. We just want the good estrogen and it to be in balance.
Right. And so estrogen, when it says, estrogen is dominant on this phase, I feel like in some women it will kind of conjure up some like, oh my gosh, well, I don't want that. You actually do want that. In this phase, you do want estrogen to be dominant, because then that's going to help all the processes that needs to happen for harmonious hormones and then also for fertility. So, and Michelle and Suzie will kind of talk about it in the rest of the phase, where in the subsequent phases, other hormones are kind of going up and high. And this is where like a slight estrogen dominance will show up as certain symptoms, but it's because other things are not, there are certain lifestyle practices that you have to incorporate to ensure that these estrogens that are being built during these phases are actually being kind of flushed out of your system. And Suzie will talk about that a little bit later.
Right. Yeah? And then there's also different types of estrogen, right? There's the good estrogen, but then there's also estrogens that we get from the environment, which are not great estrogens. And so let's see, let's go to the next slide. So during this phase, basically you've just bled, so you've lost a lot of blood, and so you want to build your blood and your yin. And so the ways that you can do that are to eat foods that are high in iron, and also foods that are rich in vitamin C, because vitamin C helps iron absorb. While you're eating these foods, you do not want to eat anything dairy, because dairy actually blocks iron absorption. And you also want to eat foods that nourish your yin. So in Chinese medicine, yin is cooling and moistening to the body. It's cooling, it's not cold, so you don't have to worry about that. And this is the appropriate time for your you to nourish yin and to have a little coolness in your body. During this time, your temperature typically is a little bit lower, and then around ovulation, it drops and then jumps and is higher. So nourishing your yin is really important. Vitamin E is another great one that helps to nourish follicles. And then during this time too, exercise is great. 30 minutes of cardio a day. You want to do this because getting your blood moving is great. You're getting that nice fresh blood to your uterus and your ovaries, which is what you want for fertility. And then what happens is your LH surges and ovulation happens. Excuse me?
Ovulation. Oh my gosh. I love talking about ovulation. It's like if your entire menstrual cycle were a movie, this would be the part where the superhero gets to fight the evil villain. So that's what I think of ovulation. That sounds insane, but I love it. It's just all about action. And what's happening here is that these eggs are actually breaking through what I called the egg house. Apparently I have all these weird analogies for everything, but really it's breaking through the follicle, making it available for hopefully a fertilization. That's what nature wants, but maybe if that's not what you want, then maybe it just, passes on its merry way. But either way, whether you're trying to conceive or not, you want a healthy ovulation, because that means that you had hopefully a nice healthy follicular phase like Michelle was talking about. You had awesome growing of those follicles. Those follicles, as they were growing, they started giving out all this estrogen in a positive way, as we were talking about. And as they were growing, one of them got really strong. And the body recognized that that one was this dominant follicle. And then your brain sends a signal to say, okay, shut off all the other ones. We're just going to let this one take over. And that's the one that we believe in. We're going to send it out into the world. Well, anyway, it's going to be sent out of the follicle. So you can tell I'm super dorky. So this is the phase where we're really trying to promote movement, because we want to help that egg release itself easily from the follicle. And that's supported by a healthy balance of hormones. So again, starting with estrogen in the beginning, and now we're moving toward, in the luteal phase, after ovulation, we're going to move toward a more progesterone dominance. So with this movement, there's many things that you can do. But one of the main things that we like to promote in Chinese medicine is to support your emotional health at this time. And it seems kind of odd. Why would that be related to ovulation? But it's because in Chinese medicine, we believe that the heart is very closely related to the uterus. They have a direct connection. And in Chinese medicine, we believe that the heart, and in Western thought, we think of the heart and our well-being, our mental well-being, as being the same. So it's really important at this time to support your emotional health. Just take time, do things that you like. Try and be just kind of grounded, be aware. If you meditate, it's great to do that. If you don't meditate, fine. Just enjoy yourself at this time. The other thing that you can do to support also movement would be gentle exercise. Here's a part of your cycle where you can do a little bit of cardio, and that's fine. And then we're talking a little bit about, you can have some more B vitamins, because that does help with the movement of the release of the egg, and perhaps with implantation down the road, if that's what you were looking for. If you are trying to conceive, you might wonder, okay, how often should we be having intercourse to target ovulation? Because sometimes it's kind of hard to know. There are certain signs that we can look for in our body, which we're going to talk about a little bit. But generally, even if you don't know when you're ovulating, if you are having intercourse every 3 to 4 times a week, separated by a couple of days, you're pretty sure not to miss your fertile window. So take heart. You don't have to be having sex every day. In fact, sometimes that can actually be harmful, because you really want your male partner's semen to be potent. And that's not something that's just thought of as important in Chinese medicine. Reproductive endocrinologists will tell you the same thing. So
can I jump in really quick too?
Please.
If you've got really great cervical mucus, the sperm actually can hang out for like 6 days. It will hang out in your cervical mucus and it gets all of its nutrients from your mucus. So that's another reason that, I mean, cervical mucus is really important. It's another reason to really take care of yourself during that first and second part of your cycle, right? To get that cervical mucus nice and juicy.
That's right. I love talking about juiciness with our cycle. All right, so I think unless does anyone have any questions about this slide, about ovulation in particular, or how it happens, or anything specific?
Really quickly, I'm coming in again. Exercise. If someone wants to work on fertility and is having issues, I would, as far as exercise goes, try to do things that are not jarring to your uterus, which is like running, right? That pounding is kind of terrible for your uterus. Some women are runners and can get pregnant easily. But if you are a runner and are having a hard time getting pregnant, I would consider maybe trying to do something else that is less jarring, like biking or swimming or something like that.
Yeah, swimming.
Swimming, yes. Susie's a swimmer.
So, like I was saying, a healthy ovulation is indicative of a healthy balance of hormones overall. So what's really happening, and this is what I find so fascinating, is that there's this amazing symphony of events that occurs between our brain and our reproductive organs. And, you know, that's seen really key here at ovulation. That's not a really good sentence, but basically it's really evident here at ovulation. So basically what's happening is the brain is releasing what's called luteinizing hormone. Once these follicles reach their peak, they're sending out, this is getting a little technical, but estrogen and inhibin to tell the brain, okay, we have one mature follicle. You don't need to keep growing them all. Let's focus on this one, and we're going to send it out, and we're going to believe in this one follicle. So then what happens is the brain says, okay, we're not going to keep letting you grow. We're going to send out this surge of luteinizing hormone. And luteinizing means to luteinize. It means to break apart. So after that surge, about 37 hours later, it's pretty precise, that's when you get this breaking through of the follicle. And that's ovulation. And it's pretty fascinating. So again, as we were talking about in the last slide, that there are some indicators to know when you ovulate. Some women feel, I think it's called Mittelschmerz, which I love. It's like the best word ever. Very German. That's where you feel that pain, a little twinge maybe, or a little bit more, maybe a little achy in either side or both sides when you ovulate. And you might see or feel the stretchy egg white cervical mucus. And what makes this different from the rest of your cervical fluid is the stretchiness. When you do this, it might stretch across your finger, right? Whereas before, if you do this and it just sort of like breaks apart or it just kind of stays there, that's not that fertile fluid. And this stretchiness is ideal for semen, for the sperm. It's what helps them climb up and on in. So that's one way to know that you're at your peak ovulatory time. And then, of course, if you are taking your basal body temperature, I don't know if you guys, some of you might not know what this is. This is when you would take your temperature throughout the month, and you'll see a rise usually around mid-cycle. And that's indicative of this luteinizing hormone surge. So if you see this rise and you're charting it, then you'll know, oh, that looks like I ovulated. Sometimes you'll see a dip right before the rise. Not everybody has that. Sometimes you will. And then along with it, positive LH surge. Some people might be seeing reproductive endocrinologists or not, and they may get a progesterone level test at around day 21. Doesn't confirm that you've ovulated, but it can help indicate that you've ovulated, because what happens is once that egg breaks through from the follicle, it then starts releasing progesterone. And the greater the levels of progesterone, the more indicative of a healthy ovulation it was. So that was kind of a heavy slide. We went through a little bit more technical stuff there. Does anyone have any questions there or thoughts?
Really quickly, Progesterone is called a day 21 lab, and that's not always true. Everyone, not everyone ovulates on day 14. If you ovulate before that or after that, day 21 actually is not going to capture a true progesterone level. And so you want to know when you ovulate, and if you're drawing a progesterone level, you want to draw that 7 days after you ovulate, right? So if you ovulate on day 16, this is going to be a day 23 lab. Mm-hmm. So I just wanted to throw that out there.
Thank you for that. Yes, that's why we have all these squigglies in there around. This is a very important phrase or word when we are talking about fertility. Everybody is different. So,
hey, Suzie.
Yes.
Do you mind if I interrupt with a couple of really good questions?
Please.
One question is, does exercising too much damage this phase?
So actually, Michelle just brought that up. It's a really good point and a really good question. So in Chinese medicine, it's all about moderation. So when I say cardio is okay there, we just don't want it to be super jarring. What I tell my patients is, look, if you're a marathon runner and you've been doing this for ages and you're struggling to get pregnant for a long time, what is your main goal? And it's hard to tell because it's very individual. But as Michelle was saying, you don't want to be jarring the uterus a lot. Some people are totally fine to do that kind of jarring cardio, but some individuals are not. So I recommend if you like to do a lot of cardio, try and have it a little bit less jarring. Swimming is ideal, but I'm a swimmer, so I'm totally judgmental, or not judgmental, I'm biased. And I'm judgmental. But yeah, so, everything in moderation. If you feel pretty healthy and you haven't been trying that long, if you are trying to conceive, then, go for it. That's okay. But if you are struggling, it's been a long time, you've been running a ton, it might be time to reevaluate.
Yes, and really, really quickly, I listen to your body. If you're tired, don't go running that day. If you're tired, don't go exercise. Honor what your body is feeling. Another one that is not great for fertility is hot yoga. Hot yoga, not great for men or women. You are just dripping out all of your yin and moisture in your body. So that's one that I try to caution my patients with is hot yoga. You can do yoga, just don't do hot yoga because you are just kind of depleting. You're depleting your body.
Yeah. And then one other question, just because it's pertinent to this slide. Could higher progesterone levels deter pregnancy for those trying to conceive?
No, I don't think so. Progesterone really, especially in the luteal phase, is what you're looking for. So progesterone usually isn't going to inhibit an implantation. If anything, it would just show that you've had a decent ovulation at the very least, depending on the numbers. Michelle, do you have any thoughts on this?
No, I absolutely agree with you. Your progesterone should be higher. The only thing that I would caution is I do have some women that are taking bioidentical progesterone. This you do want to be careful with. You want to make sure that you have ovulated. If you have not ovulated, progesterone can actually prevent you from ovulating. It thinks that your body's pregnant, right? So what did I say? I said earlier that your progesterone levels drop and you start your period. So if you start taking progesterone before you've ovulated, your body will think that you're pregnant. Right. So you won't ovulate.
Yeah. Good. Very, very, very good point. Anything else before we move on to the next slide? Good. Okay. So now we're on to the luteal phase. This is all about trying to keep your body warm, at least in Chinese medicine it is. And it's all about what we say is yang. And what is yang? So this is what we've been talking about actually is progesterone is one of the things that's yang. There's many things that are yang, but progesterone for our purposes today is one of the most yang hormones that we have. And it's produced in the ovary. And it's gonna tell your lining. So basically, estrogen really builds your lining. It builds it. Progesterone just builds it that last little bit, but then it also tells the lining to create these amazing nutrients to support a potential embryo. So progesterone is a pretty fascinating hormone. And we think of it as a very warm hormone in Chinese medicine. And this is where we have this like fun interplay of Western and Eastern. Doctors of Chinese medicine have been talking about the importance of a warm womb or a warm uterus for a very long time. I have a feeling that probably Western physicians would say, well, what does this have to do with anything? And that's fine. But I think that where we're really interested and where we see this is these higher temperatures are really borne out by this little increase in temperature that our body shows in our BBT if we are taking our basal body temperature. So it starts with that luteinizing hormone surge, and then it kind of stays up in the luteal phase higher. So in Chinese medicine, we kind of went with that and ran with it. Even before we knew what was going on, we didn't know that luteinizing hormone was around, back when Chinese medicine started. But we somehow, those physicians were amazing and they intuited that. And now it's a central part of our treatment plan during the luteal phase. And it seems to work. So what you can do during this phase, whether or not you're trying to conceive, is really to do many of the same things that we've been talking about in the beginning, especially during your period actually, is you're encouraging yang by avoiding cold and raw foods, by keeping your lower body warm, like Michelle was talking about, keeping your feet warm, keeping your legs warm. If you love to surf, if you live in Southern California, just keep in mind, are you freezing out there all the time? Just keep in mind the activities that you do. Keep in mind, are you out in the wind all the time? Cover yourself up. So these are the things that your Chinese medical practitioner will ask you about. If you do have PMS, this is a time that it's really crucial to avoid processed foods, refined sugars, coffee, alcohol, all those fun things. And the reason for that is to ease the load on your liver. So we're really finding a connection between premenstrual symptoms and liver distress. So you can increase water and fiber to help aid with that as well, because you just want to help your liver to adjust to this hormone change, because what's happening is you're having a relative drop in progesterone, a pretty severe drop in progesterone, and so that's tough on the body. So you just want to help ease the load there. And then if you are trying to conceive, you may have heard of pineapple at this time. A lot of talk about how maybe pineapple can help you when you're trying to conceive. People ask me about that a lot, so I just decided to throw it in there. So there is some empirical evidence to show that bromelain, which is an ingredient in pineapple, can help thicken the lining, so it perhaps could help with implantation. I tell my patients, go ahead, have it. It's delicious anyway. Bromelain helps with pain. Is it a surefire thing? Probably not, but it's not going to hurt you. So I just wanted to throw that in there. Any questions about this slide or thoughts? Anyone want to jump in? So really to kind of wrap up all these phases, this is a potential implantation time. And whether or not you want to conceive immediately or not at all, you still can keep your body healthy and vibrant. And by doing that, I think that you'll feel like your best self. Your libido will be strong, which is great for everybody. Your mind will be grounded. You'll be happy. These are just the things that, I think make for a great life, right? Feeling good and being happy and healthy. So the key to being happy and healthy, I think, is, if you can create this healthy lifestyle for yourself and really follow up on it. Knowing what your body needs and when is really important, and actually following through. So, like Chris said in the beginning, the menstrual period is a time when you might need to try and plan ahead to slow down a little bit. The follicular phase is a time when you're actually feeling pretty grounded and you can maybe be a little bit more flexible. The entire cycle in Chinese medicine, your acupuncturist is going to tell you pretty much never to have cold raw foods, but whatever, try and just be moderate about it at least. But yeah, so that's, I think what this is all about is just trying to live your best, healthy, vibrant life.
I think if we focus, just for, our patients, I like to focus on just the general themes of each phase. just so that people know, they're like, okay, I'm on day 5. Which phase am I in? And if we go back to each slide, it's like the first thing that we put on there, shed, right? So the period phase, we want all of the energy to be focused on shedding the lining so that there's no old hormonal information stuck in there when you move on to your whole menstrual cycle. And so if you just focus on kind of like the big themes, so menstruation is shedding. You don't want to divert that energy that's going downwards by doing activities that are just very upwards. You're like shunting that energy to do other things versus like shedding the lining. Okay, so that's menstruation. And then what Michelle talked about is before you ovulate, you're actually building, and that's the yin part. So yin is substance and yang is like warmth and movement in, simple terms. Okay, and then when you go into ovulation, it's about moving. And so what I wanted to point out here is that you're building so much yin, and if you don't move, it's going to stagnate and stay. And then that's going to cause a lot of PMS signs too. So after ovulation, you want to move, but then during the very last kind of luteal phase or premenstrual phase, you want to make sure that things are circulating and warm and things are not stagnating because you just built a lot of yin. And so if you're not moving and if you're not warming, then things get stuck and then you get like tender breasts. Most likely you'll get cramping. You'll have like brownish kind of blood show up right at the beginning or end of your actual period. So it's important to, and moving the bowels, like Suzie was saying, and helping the liver out, because the liver and bowels are so connected. It's like everything that your liver does to kind of detoxify your body, a lot of it is getting processed out of your bowels. And if your bowels are not moving, all that stuff is going to get reabsorbed back up into your liver to do the job again. And so we don't want to tax our livers like that. Okay, so that's ovulation. And then, of course, the last phase is to warm and ensure circulation is optimum. Yeah. All right. So what can I expect when I go see a fertility acupuncturist?
So I don't know how many of you guys may have seen a fertility acupuncturist, but we get this question a lot. I should have started with this part that says that it's not painful, because that's what people want to know. It's not a painful process. Otherwise, nobody would come back. But let's just start with when you first walk in, what's going to happen. And when you meet with your acupuncturist, you're going to do a thorough review of your history, even not related to fertility, just so that we can get a good idea of you. And a complete medical history is hugely important to us. And we're going to ask what we like to call the 10,000 questions, because we seem to ask, it's called the 10 questions, but we sort of say the 10,000 questions because we'll ask about your sleep, your bowel movements, your energy, your, everything that you could possibly imagine. So a lot of your first visit will just be sitting down with your acupuncturist and talking and reviewing labs.
A lot of the times we're like the first people to ask women about their menstrual cycles, really in depth about their menstrual cycles, and to let them know what a healthy menstrual cycle is, and that they don't have to like take a day off of work because they're in so much pain, right?
Absolutely. We do a very thorough review of your period.
Yes, we do.
And it's just so important to us. We get so much information from that. Same with the pulse and the tongue. People are really interested in that. We get a lot of information from your tongue. I mean, it's the opening of your digestive tract. So that's ultimately what we're looking at. And it gives us a ton of information. And same with feeling your pulse. In Western medicine, they'll take your pulse and use 2 fingers across. And they're just going for rhythm and rate. They'll also kind of feel for quality, but only if it's like really, strange and off. For us, we actually use 3 fingers across both sides. And we're feeling for rhythm, rate, and quality, and we're really interested in all 3, but especially in the quality too. So we get a lot of information from the pulse and the tongue. And then it depends on what you're coming in for, and it depends on your specific case. But generally, an acupuncture visit, is not just a one and done thing. You usually have to come in quite regularly. If it's for fertility, you almost certainly will. For fertility, it's generally ideal to come in and see someone for about 3 to 4 months, because you can help really balance a menstrual cycle in that amount of time. But that's not for everybody. Some people might come in for less time, some might come in for more. And you might come in for about 1 session a week, maybe 2, maybe once every other week. It really just depends. And then your treatment may include herbs. It might not. Some of you, or some of our patients, I should say, might be seeing a reproductive endocrinologist or going through IVF or IUI, and your physician may not want you to do herbs, and that's totally fine. So it really just depends. Depends on the patient, depends on the case. And then, of course, Western supplements are often now integrated into an acupuncturist's treatment plan. So what's a treatment like? This is where I say, first off, it's not a painful treatment. Generally, people find it really relaxing. You come in and you can just kind of relax, and you just get to lay there. And people love coming after work because then they get to just relax and go home. Some people do come in before work, but then they just don't want to go to work. But yeah, so a lot of people ask, is it a sterile procedure? Do you reuse the needles? That sounds scary. Do they stay in there? No. It's not something where they stay in you. They come out. They are sterile. They're single use, disposable. It's a safe procedure. If you're going to an acupuncturist in the state of California, you just have to be sure, they've been through the licensing process. Make sure that any acupuncturist you see has their license. And if they do, then they've gone through a lot of schooling. It is great in conjunction with Western medicine. I really recommend integrating Western and Eastern. I think that's the best way to have any sort of treatment plan for almost anything. I think that they work really well together. So that's what I recommend. And then Chris and Michelle, you guys are both phenomenal acupuncturists, and I wanted to see if you guys had anything to add for this. Or
I will say that some of my most needle-phobic new patients, where they are coming in and they're like sweating and they don't know what to expect and they're completely freaked out, usually by like their 3rd or 4th treatment, they are snoring on the table. So it really isn't scary. It really isn't. I think, we tend to think of needles as the needles that you see in a hospital, right? They're big, they're hollow because they're A, giving you medication, or B, they're taking blood from you. And those are not the needles that we use as acupuncturists. And I think also if you see movies that involve acupuncture, you see someone with like 200 needles in them, right? Because they want to like scare you. But I practice very gentle acupuncture. I would say typically I have 10 needles in, and that's it. I try to use the least amount of needles as possible. Chris, do you have anything?
Sure.
Sure.
So both Suzie and Michelle focus on helping couples conceiving. I work with women a lot in the realm of menstrual cycle education. So kind of, because it is truly kind of like this partnership that you have with your patients, because sure, they can come to you and you can put needles in and prescribe them herbs, but they have to take the herbs, they have to take the supplements, they have to do the lifestyle recommendations, right? And so a lot of what I do and what I work with patients on is like shifting and educating on kind of learning about the inner workings of their body. And I know that the main kind of thing that you work on as a fertility acupuncturist helping couples conceive is the menstrual cycle, like regulating the menstrual cycle. And of course, for the other side, for men, like increasing potency and motility and quality and stuff like that. So yeah, acupuncture is awesome.
It's amazing. And I think too, for me, the nurse in me loves labs. I'm sure Suzie, you're the same way. You love to look at labs. I love labs. And I have both that Western medicine side of education. And so for me, I kind of practice something in the middle called functional medicine, where you may go to your Western doctor and they look at your labs and they say everything looks really good. But if you go to someone that practices functional medicine, they'll actually look at it in a much different way. And they'll find things that are starting to kind of go off track and fix them before they become a big problem. There's a lot, especially thyroid. Your Western doctor will say that your thyroid looks great. If you bring that to a functional medicine practitioner, there's a very narrow zone for the fertile zone. And so they'll look at that differently and treat you accordingly.
Absolutely. Well, there you go. You, Chris.
Okay, guys, let's talk about like the most, oops, that's my son. Hold on just a second.
Okay, so while Chris is dealing with her kids, I can talk a little bit about Dow Labs and what we do with Chinese herbs. So if you're not familiar with Dow Labs, we are a newer company. We've been around for about a year. And what we've done is we've taken traditional Chinese herbal formulas and we've modernized them. So we put them into these really convenient packets. And if you've ever taken Chinese herbs, you probably know they don't taste that great. You might have to boil them. Like, they're kind of a lot of work. And if you're anything like me and you have like kids and you're already in the kitchen all the time anyways, herbs are really it might be one of the first things to kind of go from your routine. So we made them palatable and we made them easy to take. They are very effective. And I can let Chris talk a little bit about what they do and what how your acupuncturist might prescribe these. But I'm just kind of filling in for you, Chris, while you help your son.
Thank you.
No problem.
Support each other, right? It takes a village. Okay, so Chinese herbs are like my favorite part. I feel like they're so effective. Gynecology in Chinese medicine is so unique because, one of the ancients that we have, Sun Tzu Miao, he says that women's cases are 100 times more involved than a man's. And I feel like this is where Western medicine kind of lacks. It's like, you can't, give one thing, and because women are not static. We have so many ups and downs in a menstrual month. And I feel like this is where Chinese medicine shines. We recognize that women are dynamic and there's shifts and changes during a menstrual month. And that's what makes us actually healthy when we actually go through these transitions. And so what Chinese herbs, and I prescribe herbs to every single one of my patients, every single one. And so Chinese herbs support, the body as a whole. So it's like a formula. It's not like a singular kind of like supplement per se. And so the formula is made to support a certain pattern. And so with the menstrual cycle, because it does have this kind of physiological function where, the first phase is this, the second, third, fourth, you have these kind of parameters on what is healthy during each phase. And so for Dow Labs, they have two excellent formulas that really support the menstrual cycle. So I think it's called the Women's Kit, right? Okay, so the first one is Women's Formula, and that's Silwatong, and that is a yin blood nourisher. And when do we need that? We need that right after our periods. And so a lot of times, you don't, like women don't know that they have to really supplement during that time. They really have to nourish that blood that they just lost. They're still pushing on through late nights, not nourishing by cooking meals at home. And so these formulas really help to support, that particular phase of help to build yin and blood. And then the next formula, the emotional balance, that is Siazon. And that formula is translated as free and easy wander. So that formula is really great and is empirically used for a lot of the PMS signs that women get premenstrually. And so what that helps to do is really kind of help course and soothe that liver energy that Suzie was talking about that happens a lot during that time. Yeah. And just Chinese medicine and Chinese herbs in general, I feel like they're underused, but they're so effective. And I would say that if the fertility acupuncturist that you're working with, ask if they prescribe herbs, because not every single one of them do.
And let me tell you, I'm just going to jump in. These are delicious. I've tried them myself, and I was really impressed because Chinese herbs are really awful tasting. Sometimes they have a fun, it's like, I think I kind of like it, it's kind of comforting, but really they're very muddy and earthy. This is phenomenally tasty. I was really impressed with it, really impressed with it. So this is a good entryway into Chinese herbs. I'm really impressed with Dow. I just wanted to say that, Tracy.
Thank you so much, Suzie. That's so sweet. Okay, so just really quick, we have a question on what phase does the women's formula support? So that would be, you would take the women's formula after about a day after you stop bleeding. You do that for 5 to 6 days, and you're really setting yourself up for a strong ovulation. You're helping nourish that blood and realign the uterus so that when you do ovulate, there's a great place for your egg to implant. Is that, I'll defer to the acupuncturist, but that's kind of the way I understand it. And then, okay, so we have a couple of other questions. Let's see here. What do you guys think about yoni steam?
Okay, I think I'll chime in here since I'm a yoni steam expert. Okay, so I yoni steam.
Can you start with what is a yoni steam?
Oh, okay. Well, yoni, I don't know if you guys know what yoni is, but that's the Sanskrit for the vulva. Vulva, vagina, female genitals. And steaming is just exactly how it sounds. It's as if you were to steam your face. So it's steaming your vulva or vagina. They also call it vaginal steaming. So I grew up with it. My mom is from South Korea, and so I learned about the practice from my mom and my grandmother. But all across the world, especially in rural areas, it's still being used, and at some point it stopped being used, except in homes. It's a universal practice. I'm going to just try and keep it as simple as possible because I can go on and on about it. It's a universal practice that's mostly used for postpartum care to help the lochia shed completely to prevent infection and fever and stuff like that for women, and to help the uterus get back to its original size. And in Korea, they actually use it really often as a post-period practice to ensure that the actual shedding of the lining sheds completely and properly. Yeah. And you can email me if you have more questions about it.
And do you recommend it for women who are trying to conceive?
I do, but it's a very specific protocol. And for instance, after you're intimate with your partner, around ovulation, you wouldn't steam after that period, because you might be pregnant at that point. And I do recommend that you actually work with steaming and other lifestyle things for at least 3 months before trying to conceive.
Okay, and then I just have, we have one last question, which is, when is a woman's libido high?
I mean, I can jump in, and then I'm sure you guys can also jump in. This really depends on the woman. I mean, I've had patients whose libido is high in every single phase of their cycle. I've had patients whose, libido is high specifically around ovulation. I've had women's libido high on their period. So it really depends on the woman. Obviously, nature probably wants our libido to be high around ovulation, because this would be the time when they really, we're trying to get together and have the egg and the sperm meet. But in my clinical practice, I found that my patients are all over the board. So it really, there's no right or wrong time to have a high libido. Having a super high libido all the time is also a feminine thing, and I'd like to just say that, and I think it's okay, and it's not just men who can have a high libido. That being said, I also have a lot of patients who have a really low libido, and it's troublesome, and that's something that we work on. I don't know if Chris or Michelle, you have anything you want to say about that?
Oh,
No, I think you covered it.
I feel like we clicked unmute at the same time. Go ahead, Michelle.
No, go ahead. I was going to say, I agree with Suzie. It's all over the place, but nature-wise, you're going to have the highest libido around ovulation. But I have a lot of women that have really high libido right at their period too.
Mm-hmm. Yes, agreed.
And I think that's all for questions. So should we wrap up?
Yeah.
Okay, so I just wanted to talk a little bit about a challenge we have going on called Own Your Cycle. And Own Your Cycle is really about taking control of your fertility and your cycle. And it's part of the reason why we're doing these webinars, so that we can help educate women on, what is a healthy cycle, and just empowering women to really get to know their bodies. And so, as we mentioned before, we do have this women's kit, which I'm holding it up. I'm not sure if you can see. And so this is really about trying the women's kit if you have any sort of issues with your menstrual cycle that you're trying to overcome. So if you have PMS, if you have, cramping during your cycle, just if you have any sort of like spotting during your cycle. During the last webinar, Chris gave some really good tips in terms of like ways that you can take care of yourself. And I think these formulas really complement those more holistic things that you can do for your cycle health. So what we're challenging you to do is try our women's kit, try it for 2 months. If it doesn't transform your cycle, we'll give you a full refund on your money. We want you to try it. We want you to like it. We want to help your cycle get better. So if you're interested in joining us, we have a Facebook kind of like support group where we can talk about this stuff, where we can share ideas. We'd love to have you join us. And then for any woman who buys the 2-month supply of our women's kit, you're entered into a drawing to win a free month of acupuncture treatment. So if you've never tried acupuncture, as like a non-acupuncturist, I can say it is definitely life-changing. It's like, I'm not a needles person. I don't like needles. They're really scary to me. And I'm one of the clients or the patients who like snores on the table. Like, I look forward to it. It's the highlight of my month when I go. So it's definitely, I feel like it's a way to really, the herbs and the acupuncture really complement each other. So it's a great way. We've given away, let's see, it's July, so we've given away 7 months of free acupuncture treatments, and we're hearing some of the feedback from people who have never had or experienced acupuncture before, and it's been really fun to hear what people say. So, so if you're interested, if you have questions, you can reach out to us. I will add our website to the Facebook Live. If you want to link out to our website, it's just mydowlabs.com. And you don't have to do anything specific to get entered into the acupuncture drawing. It's basically just like if you buy the 2-month trial, you're automatically entered. So that's that. And then if you do buy the 2-month trial, you can get a 20% off discount using Chris's code, which is Dr. Kristin. So 20% off, and that's if you buy through next Wednesday. So you have a week to think about it. If you have questions, ask, please do. And definitely use that code because that's a really good discount. And the 2-month trial is already discounted, so it's a good deal. And I'm going to put myself on mute because my kids are
I just want to chime in really quick. So I feel like for most women who have menstrual cycle challenges, more often than not, it's just these simple things that you can add in a consistent way, because that's what your menstrual cycle is. It's such a consistent physiological function of your body. And so all it really needs is that support through each one of those phases. And so incorporating the formulas is a way to actually do that. And so also, if you go back to this slide and maybe download it, have it somewhere kind of up on your fridge or something with all 4 phases, you can start to slowly incorporate the lifestyle recommendations for each phase. And a lot of the time, I always tell my patients that your greatest medicine is like inside. Like your body is so intelligent, it knows how to heal itself. You just have to give it the right ingredients, and yeah. Oh. Okay, so Suze, you want to chime in?
Sure. So this is just a little plug for this. I'm really excited about this. I have a twin sister named Maggie, and she's amazing. She's a naturopath, and I'm really excited because we've both worked together on this comprehensive online fertility program that we've dubbed fairly self-centeredly, if I can use that as a phrase, the Husami fertility method, because our name is Husami. So if you are trying to conceive and you don't have access to an acupuncturist, or you don't have the time to come in, or you live across country, or you're just interested in trying to do something really comprehensive and, take control and get it all done yourself, and also get benefits from Western supplements and Chinese herbs at the same time, because that's what makes it different, then by using this code, the Husami method code, and there shouldn't be a parentheses on the end of that. That was my fault. If you contact me, and that's my business number there, and you mention this code, then you can get 40% off. It's coming in fall. We're still developing it, but it's almost done, and I'm really excited about it. We've put a lot of time and effort into this, and it's my new baby. So that's what I have to say about that. I think that's it.
Okay, we have another quote. Every woman has a profound connection with her menstrual cycle. It's so true. Okay. All right, this is our contact information. And do we have any last questions, Tracy?
We did have one last question. Let's see. Do you have any opinions on integrating essential oils into seeing a fertility acupuncturist?
Anyone in particular want to take that one? I use essential oils in my practice. I just use therapeutic grade. That's my biggest thing that I harp on about. I think it's fun to use, and I think they smell great, and they make me personally feel great, so I use them with my patients. Kristin, actually, Chris, I'm going to call you Kristin, I'm going to call you Chris. She introduced me to my favorite essential oil company, which is doTERRA. However, I believe they used to be related to Young Living, or I'm not sure, but I just like their packaging and I like the way their scents smell. But that's what I have to say about it. I do use them in my practice though. Michelle or Chris?
I agree with you, Suzie. Same thing. I use them in my practice, and I tend to use either doTERRA or Young Living too, and then Snow Lotus. Those are the 3 that I usually use.
I've actually moved on to Snow Lotus.
I need to get into Snow Lotus.
So I've actually
too.
I've actually taken courses on applying therapeutic grade essential oils to acupuncture points, and so I integrated a lot in my treatments. But then using them for yourself at home, Michelle and I, we just recently launched a breast e-course where we actually teach women how to massage their breasts for menstrual health and for overall health. And it includes essential oils and making your own blend, or when you buy a blend, knowing which oils are best for, reproductive well-being. Yeah, so I love essential oils, yes. The therapeutic grade for sure. All right.
Okay, thank you so much to our panelists. This was such great information. And then thank you to the people who hung out with us. Like, you guys just listened to an hour and 15-minute presentation on the menstrual cycle, which I feel like is amazing. So we're so thrilled to be putting this on. We really appreciate everyone taking the time out of their day. And then again, to the women who put this presentation on, this is just such great information. You guys are really doing the hard work of like sharing all of this, and I couldn't be more appreciative. So thank you, ladies, so much, and we'll talk soon. All right.